What's up everybody? It's Dr. Youn, America's holistic plastic surgeon. Welcome back to my channel. Now, I've dedicated my career to helping people look and feel their best, but I do it with a holistic approach focusing on overall health and natural-looking results. Plastic surgery, when done right, can be a wonderful, life-changing thing. But when it goes wrong, it can go wrong. That's what we're diving into today. I've seen some pretty wild things in my time, but some of the cases we're about to look at are truly next level. Today, we're going to be reacting to some of the most extreme plastic surgery disasters ever caught on camera. We're talking about procedures that have unfortunately resulted in outcomes that are far from what the patient or any reputable surgeon would ever want. My goal here isn't to shock or scare you, but to educate. We'll break down what likely went wrong, why it happened, and most importantly, how you can avoid these kinds of devastating results if you're considering cosmetic procedures for yourself. It's all about making informed, safe choices. So, get ready for some real, honest, and expert reactions. We're going to cover everything from botched fillers to facelifts that have gone terribly awry. I'm going to give you my unfiltered professional opinion on these cases. It's going to be an eye-opening journey, so grab your popcorn, settle in, and let's get started. I promise you'll learn a ton, and see why choosing the right surgeon and having realistic expectations is absolutely critical. Let's dive in. Alright, first up, we're tackling one of the most common procedures that people get, but also one that is so frequently overdone: lip fillers. Let's take a look at this first image. Wow. Okay, so what we're seeing here is a classic case of what we call overfilling. The lips are distended, they've lost their natural shape, and they have that characteristic sausage or duck lip appearance. The natural Cupid's bow is completely obliterated, and the border of the lip, the vermilion border, is so stretched that it looks unnatural and almost painful. This is not the goal of lip augmentation. The goal should be to enhance the natural shape of the lips, adding subtle volume and definition. When you inject too much filler or you inject it in the wrong places, you create this kind of distortion. The lips are a very delicate and dynamic structure. They have specific anatomical landmarks, the tubercles, the philtral columns, the Cupid's bow, that a skilled injector respects and enhances. When an injector just pumps filler in without regard for this anatomy, you get a result like this. It's a telltale sign of an inexperienced or overly aggressive practitioner. So, why does this happen? Often, it's a combination of factors. It could be a patient who has body dysmorphia and keeps asking for more and more, not realizing they've gone too far. It could also be an injector who is either unqualified, using the wrong type of filler, or simply lacks the artistic eye required for this procedure. Not all fillers are created equal. Some are thicker and provide more structure, while others are thinner and better for subtle hydration. Using a thick structural filler and injecting large quantities is a recipe for this kind of disaster. Another major issue is the filler fatigue, or the desire for an instantly dramatic result. Some people see celebrities on social media with very full lips and want to replicate that look in a single session. This is a huge mistake. Building up lip volume should be a gradual process, often done over multiple appointments. This allows the tissue to stretch slowly and gives the injector better control over the final shape. Rushing the process and putting in several syringes at once is how you end up with this swollen, unnatural appearance. The danger here isn't just aesthetic. Overfilling can lead to serious complications. It can stretch the skin so much that it becomes thin and fragile. More critically, it can compress the blood vessels that supply the lips. If you block an artery, a condition called vascular occlusion, it can lead to tissue death or necrosis. This is a medical emergency that can result in permanent scarring and disfigurement if not treated immediately by dissolving the filler with an enzyme called hyaluronidase. Let's look at the side profile in this picture. You can see how the lips project unnaturally far from the face. This is what we call the simian look, or a monkey-like appearance, where the upper lip protrudes excessively. A well-done lip augmentation should respect the natural facial planes. From the side, the upper lip should project slightly ahead of the lower lip, but not by this much. This profile is a dead giveaway that way. Way too much filler was used, particularly in the upper lip. To avoid this, the number one thing you can do is your research. Find a board-certified dermatologist or plastic surgeon, or a highly experienced nurse injector working under their supervision. Look at their before and after photos. Do their results look natural? Do they all look the same? Or are they customized to each patient's face? A good injector will say no when they think you're asking for too much. They are your guardian of safety and aesthetics. Communication is also key. During your consultation, be very clear about the look you're going for. Bring in photos of lips you find beautiful, but also be open to the injector's expert opinion on what will suit your unique facial anatomy. A great injector will analyze your face and tell you what's realistically achievable and what will maintain harmony and balance with your other features. They won't just inject, they will consult and create a plan with you. Remember, the less is more approach is almost always the best approach, especially when you're starting out. You can always add more filler later, but it's much more complicated to correct overfilling. You might need to have it dissolved, which can be an uncomfortable process, and then start over. It's better to start conservatively, live with it for a couple of weeks, and then go back for a touch-up if you decide you want a little more volume. So, the takeaway for lip fillers. Do your homework on the provider, insist on seeing their work, start slow, and understand that beautiful lips are about shape and proportion, not just size. Don't chase a trend you see on Instagram. Chase a result that enhances your own natural beauty. This picture is a powerful warning of what happens when those principles are ignored. It's a disaster that was, in all likelihood, completely avoidable with the right provider and a more conservative approach. Now we move on to something much more invasive. The facelift. A facelift, or rhinoplasty, can be one of the most powerful procedures for facial rejuvenation, taking years off a person's appearance. But when it's done poorly, the results can be truly startling and irreversible. Let's look at this case. Oh my. This is what we in the industry refer to as the wind tunnel or pulled look. It's the classic sign of an outdated or overly aggressive facelift technique. You can see that the skin is pulled incredibly tight, especially around the corners of the mouth and the eyes. The natural facial contours are gone. Instead of lifting the underlying tissues vertically against gravity, the surgeon has likely just pulled the skin horizontally and backward. This flattens the cheeks, distorts the hairline, and gives the patient a perpetually surprised or stretched expression. It doesn't look younger, it just looks operated on. And that is the absolute last thing you want from a facelift. The goal of a modern facelift is not to pull the skin tight, it's to reposition the deeper layers of the face, the SMAS layer, superficial musculo-aponeurotic system, back to where it was in youth. Think of it like making a bed. You don't just pull the sheet tight, you first pull up the underlying mattress pad and blanket. In a facelift, we lift and suspend this deeper SMAS layer, and then the skin is simply redraped over it with very little tension. This creates a natural, refreshed look, not a tight, pulled one. What we're seeing in this photo is likely the result of a skin-only facelift, a technique that is largely considered obsolete by most reputable plastic surgeons today. In this procedure, the surgeon just undermines the skin, pulls it back as tightly as possible, and cuts off the excess. This not only creates an unnatural look, but also puts all the tension on the skin and the incision lines, which can lead to wide, visible scarring and a result that doesn't last very long, as the skin will inevitably stretch back out. Another sign of a bad facelift you can see here is the distortion of the earlobe. This is called a pixie ear deformity. You can see how the earlobe, instead of hanging freely, is pulled down and attached directly to the skin of the cheek. This happens when the surgeon pulls the skin too tightly around the ear during closure without properly anchoring the tissues. It's a dead giveaway that someone has had a poorly executed facelift, and it's something that is very difficult to correct. Furthermore, look at the corners of the mouth. They are pulled outwards, creating an unnaturally wide mouth, sometimes called a joker smile. The natural smile lines, or nasolabial folds, haven't been softened in a natural way. They've been stretched flat. This completely changes the person's expression and can make them look strange, both at rest and when they're trying to animate their face. It's a result of pulling in the wrong vector, horizontally instead of vertically. To ensure you get a safe and natural-looking facelift, choosing the right surgeon is paramount. This is not a procedure you want to bargain shop for. You need a board-certified plastic surgeon with extensive experience in facial rejuvenation. You must ask them specifically what type of facelift they perform. Do they address the deep plane or the SMAS? Ask to see dozens of their before and after photos, paying close attention to the scars, the earlobes, and the naturalness of the expression in the aftershots. The consultation is your opportunity to interview the surgeon. They should spend a significant amount of time with you, analyzing your facial structure, your skin quality, and your specific areas of concern. They should explain their proposed surgical plan in detail, including the incision placement and the technique they will use. If a surgeon seems rushed, dismisses your concerns, or promises a result that seems too good to be true, that is a massive red flag. A good surgeon will also manage your expectations. A facelift can make you look like a rested, refreshed version of yourself, but it cannot stop the aging process, and it cannot make you look like a different person. The goal is restoration, not transformation. Someone who promises to make a 60-year-old look 20 is not being honest. A realistic goal is to look 10 to 15 years younger but still look like yourself. Ultimately, the tragedy of a result like the one in this photo is that it is often very difficult, if not impossible, to fully correct. Once the skin has been overstretched and the natural landmarks distorted, revision surgery is incredibly complex. You can't just unpull the skin. This person is likely stuck with this appearance for the long term. It's a sobering reminder that with surgery the stakes are incredibly high, and the importance of choosing a master surgeon cannot be overstated. Let's move on to the body. Breast augmentation has been one of the most popular plastic surgery procedures for decades, but there's a big difference between a tasteful enhancement and going to the extreme. And this next image, wow, this is what we call overdone. We're looking at breast implants that are clearly way too large for this patient's frame. This is a classic example of proportion being completely ignored. When we talk about breast augmentation, the goal should be to create a result that is harmonious with the rest of the body. We consider the patient's height, their weight, the width of their chest, the width of their shoulders and hips, and the amount of natural breast tissue they have to begin with. The implants in this photo are so large that they dominate her entire torso. They look like two balloons stuck on her chest, rather than a natural part of her body. This is a hallmark of poor planning and, honestly, sometimes unrealistic patient expectations. This bolted-on look is a telltale sign of implants that are too wide for the chest wall. You can see there's no gentle slope from the collarbone to the breast. It's just an abrupt shelf. This happens when a very large, high-profile implant is placed in a person with a narrow frame. A good surgeon would have advised this patient that her anatomy cannot support an implant of this size and still look natural. The implant should ideally fit within the footprint of the natural breast. Beyond the aesthetic issues, going this large poses significant health risks. Extremely large and heavy implants put a tremendous amount of strain on the skin and the surrounding tissues. This can cause the skin to thin out over time, making the implant more visible and palpable, a condition we call rippling. The weight can also lead to chronic back, neck, and shoulder pain, as well as poor posture. It's a heavy burden to carry, quite literally, every single day. Another major concern with overly large implants is a complication called bottoming out. This is where the weight of the implant pushes down on the lower part of the breast, causing the inframammary fold, the crease under the breast, to drop lower and lower. This can result in the nipple pointing upwards and an unnaturally long distance between the nipple and the fold. It's a difficult problem to correct surgically and is a direct consequence of choosing an implant that is too heavy for the tissues to support. We also see in this photo the issue of symastia, or what people call a uniboob. This is where the pockets created for the implants merge in the middle, and the space between the breasts is completely lost. It can happen if the surgeon dissects the pockets too close to the sternum, or if the sheer size and pressure of the implants cause the tissue in the center to break down over time. This is a very serious complication that requires complex revision surgery to repair. So how do you avoid this? It comes down to a realistic and honest consultation with a board-certified plastic surgeon. A responsible surgeon will use sizing systems and even three-dimensional imaging to help you visualize what different implant sizes will look like on your body. They will guide you toward a size that complements your frame, not overwhelms it. If a surgeon agrees to any size you ask for, without discussing proportion and risks, you should walk out the door. It's also important for patients to have a healthy perspective. The goal shouldn't be to have the biggest breasts possible, but to have breasts that make you feel more confident and proportional. Bringing in photos is helpful, but it's crucial to understand that the result you see on a 5'10" model may not be achievable or look good on your 5'2" frame. The surgeon's job is to translate your aesthetic goals into a result that is safe and beautiful for you. Many patients who go too big initially often end up seeking revision surgery years later to go smaller. They get tired of the unwanted attention, the physical discomfort, and the unnatural appearance. This means undergoing another surgery, with more cost, more risk, and more recovery time. It's far better to choose a reasonable, appropriate size from the very beginning. In summary, when it comes to breast implants, bigger is definitely not always better. This photo serves as a stark warning against prioritizing size over proportion and safety. A successful breast augmentation is one that no one can be sure you've had. It should look and feel natural, be comfortable, and be in harmony with your entire body. This result is the exact opposite of that, a surgical outcome that screams unnatural and carries significant long-term risks. The nose is the central feature of the face, so when a rhinoplasty or nose job goes wrong, it can be devastating because there's no hiding it. This procedure requires a unique blend of surgical precision and artistic skill. Let's examine this case. Oh dear, this is a classic example of an over-resected or scooped nose. It's a look that was unfortunately popular in decades past, but it's something that skilled surgeons today actively avoid. What you're seeing here is a nasal bridge that has been taken down way too much, creating a ski slope or saddle nose deformity. The profile is unnaturally concave. A strong, straight, or slightly sloped bridge is considered aesthetically pleasing in most faces. This scooped-out appearance immediately signals nose job and disrupts the harmony of the facial profile. It's a sign that the surgeon was too aggressive in removing cartilage and bone from the dorsum, or bridge, of the nose. Furthermore, look at the tip. It appears pinched and overly rotated upwards, exposing too much of the nostrils. This is often called a piggy nose, and it's another result of aggressive cartilage removal. The surgeon likely removed too much of the lower lateral cartilages that form the structure of the nasal tip. Without that support, the tip can collapse inward, causing the nostrils to retract and creating both an aesthetic problem and often a functional one. This brings me to a critical point. A nose job isn't just about looks, it's about function. The nose's primary job is to allow you to breathe. When a surgeon is too aggressive and removes too much of the structural cartilage, it can lead to nasal valve collapse. This is where the nostrils collapse inward when you try to breathe in, causing a significant obstruction. Many patients who have had these kinds of reductive rhinoplasties end up with chronic breathing problems, a terrible trade-off for a nose that doesn't even look good. Another issue we can see here is what's called an inverted V deformity. If you look at the middle part of the nose from the front, you can sometimes see the edges of the nasal bones, creating the shape of an upside-down V. This happens when the upper lateral cartilages detach from the nasal bones after the bridge has been lowered too much, without proper reconstruction. It's another telltale sign of a poorly performed rhinoplasty. Revising a nose like this is one of the most challenging operations in all of plastic surgery. It's called a revision rhinoplasty, and it's incredibly complex. Because the surgeon removed too much tissue, the revision surgeon has to add structure back in. This often requires harvesting cartilage from other parts of the body, like the ear or even a rib, to rebuild the bridge and support the tip. It's a long, difficult surgery, with less predictable results than a primary rhinoplasty. So, how do you find the right surgeon and avoid a nightmare like this? You must choose a surgeon who specializes in rhinoplasty. This is a surgery of millimeters. It is not something for a general plastic surgeon who only does a few nose jobs a year. Look for a board-certified plastic surgeon or a facial plastic surgeon, that's an ENT with fellowship training, who has a gallery full of natural-looking rhinoplasty results. During your consultation, the surgeon should use computer imaging to show you a realistic simulation of what your nose could look like after surgery. This is a crucial communication tool. It ensures that you and the surgeon are on the same page about the aesthetic goals. If they don't use imaging, or if the simulated result looks unnatural or done, be very wary. A good rhinoplasty surgeon practices the art of subtlety. Ask the surgeon about their philosophy. Do they favor a preservation rhinoplasty approach? This is a more modern technique where the surgeon preserves as much of the natural cartilage and bone as possible, reshaping it rather than aggressively removing it. This leads to more natural, stable, and predictable long-term results with a lower risk of breathing problems. The key takeaway is that rhinoplasty is about refinement, not radical change. The goal is to create a nose that fits your face so perfectly that no one notices the nose itself. They just see your beautiful eyes and smile. The nose in this photo does the opposite. it draws all the attention, for all the wrong reasons. It's a permanent reminder of a surgery that took too much and left the patient with a host of aesthetic and potentially functional problems. We started with fillers, and we're going to end with a specific filler complication that is becoming more and more common: filler migration. This is when the hyaluronic acid filler that was injected into one area of the face moves to another. Let's take a look at this image. Here, we're seeing a classic case of under-eye filler migration. This person likely had filler injected into her tear troughs to correct dark circles or hollows, but now she has these puffy, lumpy bags instead. So why does this happen? The under-eye area is incredibly delicate. The skin is very thin, and it's a very dynamic area with lots of tiny muscle movements from blinking and smiling. If the wrong type of filler is used, one that is too thick, or attracts too much water, or if it's injected too superficially, meaning too close to the skin's surface, it can look lumpy. But migration is a different issue. It happens when the filler moves from its intended location over time. One of the main reasons for migration, especially under the eyes, is injecting too much filler at once. The tissue in the tear trough can only hold so much volume. If you overfill it, the filler has nowhere to go but to spread out, often moving downwards onto the upper cheek, creating these puffy mounds. This is why a conservative approach is so critical. It's always better to underfill the tear trough and add more later than to overfill it from the start. Another cause is improper injection technique. The tear trough should be injected deeply, right on top of the bone, which is the orbital rim. If the injector places the filler more superficially, within the muscle or the fat pads, the constant movement of these tissues can essentially milk or push the filler to a different location over time. This requires an injector with a profound understanding of the complex anatomy of the periorbital region. This isn't just a problem under the eyes, we also see filler migration in the lips. Let's look at this example. You can see a filler mustache here. This is when lip filler, injected to plump the body of the lip, migrates outside the vermilion border into the white part of the upper lip. This creates a puffy, shadowy shelf above the lip, which can make a person look unnatural, almost simian. It blurs the beautiful, crisp line that should define the lip. This happens for similar reasons: using too much filler, repeated injections over many years without letting the old filler dissolve, or poor technique. If an injector isn't precise and injects outside the vermilion border, or if the pressure from overfilling the lip body forces the product to seek the path of least resistance, it can end up in this perioral area where it doesn't belong. The good news about hyaluronic acid filler migration is that, in most cases, it is correctable. Because these fillers are not permanent, we can use an enzyme called hyaluronidase to dissolve them. The hyaluronidase is injected into the areas where the migrated filler is, and it breaks down the product, which is then naturally absorbed by the body. The patient's face can then return to its pre-filler state. However, the dissolving process isn't always a simple one-and-done procedure. It can sometimes cause swelling and bruising. It may take more than one session to fully dissolve a large amount of migrated filler. And there's a small risk that the hyaluronidase can affect some of the body's own natural hyaluronic acid, though this is usually temporary. After dissolving, the patient has to wait a few weeks before they can have filler injected again, this time by a more skilled practitioner. To avoid filler migration, the rules are the same as what we've discussed before. First and foremost, a top-tier injector is non-negotiable. Ask them what specific type of filler they plan to use for the area and why. For tear troughs, you want a very thin, smooth filler that doesn't attract a lot of water. For lips, you want a product with the right balance of structure and flexibility. And be patient. Facial balancing with fillers is a journey, not a race. Don't expect to fix 10 years of volume loss in a single 30-minute appointment. A great injector will create a long-term plan with you, layering small amounts of filler over time to achieve a beautiful, stable, and natural result. If you feel pressure to get multiple syringes injected at your very first visit, that is a warning sign. These migration mishaps are a clear illustration that with fillers, technique and a conservative approach are everything. And that's a wrap. We've seen some pretty extreme examples today of what can happen when plastic surgery goes wrong. My hope is that this has been educational and empowering for you. Understanding the potential risks and seeing these worst-case scenarios really highlights the importance of doing your research, choosing a qualified, board-certified expert, and having realistic expectations. Remember, the goal of any cosmetic procedure should be to enhance your natural beauty and boost your confidence, not to transform you into someone else or create an unnatural result that you'll regret. But you know, surgery and injectables aren't the only path to looking and feeling your best. A huge part of my holistic philosophy is taking amazing care of your skin every single day. That's why I created my skincare line, YOUN Beauty. All of my products are based on natural ingredients, they're cruelty-free, and they're designed to give you real results and healthy, glowing skin without the need for invasive treatments. So, if you're looking for high-quality, clean skincare that I personally stand behind, please check out younbeauty.com. Thank you so much for joining me today. I really appreciate you spending your time with me. If you found this video helpful or interesting, please give it a thumbs up. It really helps the channel. And don't forget to hit that subscribe button and turn on notifications so you don't miss any of my future videos, where I'll be reacting to more trends, debunking myths, and giving you all my best holistic beauty tips. Stay safe, do your research, and I'll see you on the next video.